All right, thank you very much, Rock FM and RB TV, for covering this event. I'm Dr. Von Kandel, the regional coordinator for HIV/AIDS for the Southwest region, and we just ended a 3 days training of district key stakeholders, particularly the district medical officers and the data managers at the level of districts, on the DHIS2 system. The DHIS2 is in full, it's an acronym which stands for the District Health Information System version 2. And this is the main system that the Ministry of Health is using to collect and transmit data for decision making. You know, the data is very important for policy making, decision taking at the level of the district, at the level of the region, and at the central level. And this training of these key stakeholders at the districts is going to improve on the data quality in the district, such that at the level where decisions are being made, we have good quality data that reflects the reality in terms of the health situation. In this case, we are talking about the HIV/AIDS pandemic, looking across the three cascades, such that as we move into 2025 and years beyond, we should be able to streamline our activities to make sure that the gaps that are still existing in the care of HIV patients are closed. So basically, this was what the training was on. We also looked at the new tools that have been developed since, in terms of the tools that will be used in documenting. And just after this training, we are going to be having scale down training at the level of the districts, where health facilities staff are going to be trained by the district trainers to ensure that documentation and the reporting of activities is optimal. Thank you.
Doc, before now, how was the district, how were the health workers coping in terms of data collection and analysis?
The GHIS2 has always existed in the districts for as long as the districts are existing. This was more of a refresher course, and you know, as years go by, there is need for new data to either monitor progress in terms of target achievement for certain indicators or for decision making. And this need for data also spurs the updates of documentation tools and registers that are found at the health facility. And with time, you'll find these tools evolving and having more indicators. So basically, this was just a refresher course to bring to limelight the key changes that have been made in terms of indicators that the districts and health facilities are supposed to report on, and make sure that these key actors are able to understand these indicators and report appropriately on them.
We are talking here about public health, and a layman listening to you will be interested to know how this update, this improvement will benefit them.
Yes, these updates are very important. First, it is going to answer a number of questions where the data wasn't existing before. We should be able to have the information. Secondly, we are going to have an improve. I think with the training, we are going to have better quality data, and decision makers at the regional and central level will be able to use this data to take decisions that are going to directly impact service delivery for all Cameroonians in the various communities where they are from.
Thank you very much, Doc, for talking to us. And before you go, we are on the eve of World AIDS Day. A word or two to Cameroonians and those around your area of jurisdiction.
Okay, thank you very much for coming back on that. The World AIDS Day commemoration activity is an activity that commemorates those who have died from HIV/AIDS. This year's theme is take the rights part, rights like in the rights of the patient. We know that the HIV is a disease that has had a lot of issues around stigma and discrimination, and as the gaps in terms of advances that have been made to provide care to treat and maintain patients on treatment have improved. We have this stigma and discrimination that is lagging behind, and we think this year's theme is timely to ensure that we respect the rights of these patients living with HIV, and ensure that they have access to care, they have access to even services that are not healthcare related, same as every other person, because HIV is just one of those other diseases that exist. Thank you.